Can I inquire from the gentlelady how many more speakers she has?
I have no more speakers.
Well, then I will close, Mr.
The
Speaker.
gentleman is recognized to close.
Mr. Speaker, here is the bottom line. Congress must act now to prevent one of the most staggering health care premium hikes in history. Not in November, not in December, but now. Now, let's be honest. Donald Trump and his billionaires he surrounded himself with won't feel an ounce of this pain. They've got the best doctors on speed dial, concierge care, private chefs. They don't worry about grocery bills. They don't sit at the kitchen table with a stack of medical bills and wonder which one of them they can afford to pay this month. But regular people do. Working families do. Seniors on fixed incomes do. And that's what Democrats are fighting for. Regular people who buy their own food, who worry about the rent, who pray the car doesn't break down because they can't handle another bill. So if you want to stand with the billionaires, by all means, vote for this CR. Let 1 million people get kicked off of health care. It won't impact members of Congress. We all have great health care. Republicans don't have to worry about that. But guess what? Democrats are not going to stand by and watch while Republicans make health care more expensive and less accessible for millions of our friends and neighbors. So stop the cuts and fund the government, or own the shutdown that's coming. Protect people's health care, or own the consequences when millions lose their coverage. That's what the choice is for this Republican-controlled government. And right now, Mr. Speaker, it sure as hell looks like Republicans are choosing to shut it down instead of working to keep people insured. Again, we live in the richest country in the world. You know, health care ought to be viewed as a fundamental right for people in this country. People shouldn't have to worry about going bankrupt if they get sick. You know, I mean, this is one of the top issues on the minds of people all throughout this country right now. The price of groceries and the price of health care. That's what they're worried about. People are deeply concerned that they're going to not be able to afford both. And they are in for a rude awakening when come November they start to see their premiums go up. And here's the kicker. This Congress can do something about it. All we need is our Republican friends to just, to work with us, let us make the necessary adjustments, and let us protect millions of people from losing their health care. Let us protect countless people from seeing their premiums go sky high. I mean, we can do this. This is solvable. We can do it. But for whatever reason, Republicans are not interested. And that is what is particularly sad at this particular point, Mr. Speaker. Prohibiting health insurance companies from denying coverage because of a person's medical history. That's what Democrats did. We prohibited health insurance companies from denying coverage because of a person's medical history. We prohibited health insurance companies from charging sick people more. We prohibited private health insurance companies from denying coverage because of pre-existing medical conditions. We prohibited health insurance companies from denying coverage to pregnant women. We prohibited private health insurance companies from charging sick people higher premiums than healthy people. We required health insurance companies to cover the cost of most preventative services. We prohibited health insurance companies from setting a lifetime limit. We gave states the option of expanding their Medicaid programs. We provided financial help to low and moderate income Americans to help them purchase coverage. We prohibited private health insurance companies from setting an annual limit. And we also allowed young adults to stay on their parents' insurance plans until they were 26. That's, when we think of like helping people with health care, that's kind of the stuff that we think of. And as I mentioned before, capping the cost of insulin in Medicare. I mean, we ought to be making it easier for people to get good quality health care. We ought to make sure it is more affordable and more accessible. And we're going in the opposite direction under this Republican leadership. So, Mr. Speaker, again, I urge my colleagues to vote no on this rule for a whole bunch of reasons, but mostly because health care is important to people in this country, and they're about to get screwed. And we have an opportunity to do something. And I regret that under this rule, nothing will be done. Nothing will be done. So let's defeat this rule. Let's go back to the drawing board. Let's sit down in a bipartisan way. Let's figure out ways to avert this crisis. And let's do what's right for the American people, not what's right for the big contributors in this country and for the well-off and the well-connected. And I urge a no vote, and I yield back.